Hello, everybody. Welcome back to our webinar series. Sonia and I at Mental Health are very happy to see you. And we have a special guest today, Dr. Emilie Ravn, who's a veterinarian extraordinaire, who is going to join us today to talk about pet loss, planning and coping, planning for it and coping with it. I think among many, it's even the word pet seems problematic. Doesn't seem to do justice to what these relationships are. I mean, speaking for myself, I don't, whether it was my service dog Vermont or my dog Maisie now, or the cats, or any, I can go on, but there are no more important relationships in my life, and I love people too. It's not well, either or, but just say these are enormous relationships for many of us. And society tends to not really carve out a lot of space for it. You'll hear things like, oh, well, you gonna get another dog yet? You know, like they're sort of interchangeable. And again, the word pet just seems like it's like a plaything or a toy or what's the word I'm looking for? You know, when you wear jewelry and stuff or anyway, but I'll come to the word later.
Accessory, maybe?
What was that?
Accessory?
There it is. Yes. Dr. Ravn accessory. Yes. But these are way bigger connections than that for many of us. So I probably don't need to say all that. A lot of you guys on the call probably know. So but before we dig in with Dr. Emilie, let's do our sort of level setting here for those of you who may be new. Let me cut to you, Sonia, in a second, but just to say, these are meant to be just safe places to think and feel just about anything within the boundaries of law and morality. So we really encourage folks to participate. Emilie and I are going to share I'll run through the slides, and Emilie will have a lot of thoughts, and I'll chirp in too. But that's just for the first half of the show, just to sort of get some basic information out there, level set a little bit. But really the fun stuff is the dialogue, the questions and answers, just basically talking with each other. And do feel free to respond to each other. So as questions come up, please respond to it just as a group effort. So with all that, let me cut over to you, Sonia.
Thank you, BJ. Hi, everyone. Thanks so much for being here with us. Just wanted to go over the ways you can interact with us after Emilie and BJ have kind of gone through the slides here. So you can raise your hand. There's a little raise hand button, and we will unmute you, and then you can ask your question out loud. And if you prefer to not do that, you can type your question into the question area, and I can read it aloud for you for Emilie and BJ to answer. Other quick note is if you prefer to remain anonymous, that is absolutely no problem. Please just let us know when you write the question that's what you would prefer, and we'll keep your name out of it. And then another quick note here, when I was making the slides for this presentation, there are some images that are emotionally inducing. So I'm just going to put that out there as a warning. They're very beautiful, but they definitely evoke emotions. So just going to put out a quick warning on that. So again, you can raise your hand, ask us a question, or you can type it in and I will read it aloud for BJ and Emilie to answer. Thanks again for being here.
All right. Thanks, Sonia, as always. Let me just go back one slide. You know, you like to blur the professional and personal lines around here to some degree. So I'm going to introduce you to my little family here. That's Maisie, my dog. She's 12. Half pit bull, half German shepherd, and that's Darkness, the black cat, and then the Muffin Man. Those guys are about 16. So we're bordering on a geriatric household here. But anyway, that's the family. They say hello. Okay, let's move on. All right. Emilie, you want to jump in here with us?
Sure. When we're talking about, end of life measures and things like that, we oftentimes wonder, when is it time for our pets? We don't want them to suffer. It's not only about, them suffering, but we also have to talk about, the quality of life of the owner, so you guys, when we're talking about if it's coming towards the end, really we are looking for specific changes in behavior, and every pet's a little bit different, and the person who knows the pet the most is yourself, is the owner. So you're going to be able to assess these changes better than anybody. We're talking about changes in social functions, so are they interacting normally with the family? Is there any, hiding? Cats tend to do that when they're feeling ill, or secluding themselves. Is there any unusual aggression or fear that's going on? Those might be kind of an indicator of, if a pet's quality of life is being hampered, and to kind of try to dive in deeper to, what's going on with the pet, or perhaps even come to grips with, it might be close to the end of your pet's life. The other things that we're looking for are things like changes in natural functions. So what's the appetite like? The appetite isn't the most important thing, because you might have a Labrador, for example, who can't get up and is soiling himself and really does have poor quality of life because of those issues, but he might still continue to eat a healthy meal. So that's just, you kind of have to take it into consideration with the pet themselves. We're talking about changes in thirst. So, if a cat has been diagnosed with diabetes or with kidney disease, the thirst level tends to get really, really high, especially if the diseases are progressing and not controlled. And then we're talking about urinary habits. So are they able to use a litter box or be able to pee outside, or are they soiling themselves? Their defecation habits, same thing. It can be very distressing. Cats are quite fastidious beings, and dogs are trained to go outside for the most part. So, when they're all of a sudden not being able to do that, that can affect their quality, because not only can it lead to secondary problems like skin problems, but it can also lead to anxiety and fear, because they usually are told off, perhaps if they go in the house. And then finally, the ability to move around or to ambulate. That's probably the most important with our bigger dogs. So, if they're not able to get up anymore, there are certain things that we can do to help them, but, mobility for those pets is very important, because they're so big, and it's limited what we can do for them. And then just a couple more things, what's their mental health like? Are they still enjoying the things they love to do? For example, playing fetch, or, playing with a feather toy for a cat. Are they hating the things that they normally hate? For example, a dog, running to the running to the front door when the mailman comes, barking at him. Is he not doing that anymore? That should be a red flag saying there's something up. Are there any signs of stress or anxiety? Is there any restlessness or pacing? All of these signs are really important to monitor for, to just kind of understand where things are going with your pet, and if we're starting to see quality of life issues.
Emily, I was just going to jump in. Is there a sense like, how do you glean when the pet's having a bad day or ate something funky in the yard? Or,
Yeah.
is there I'm assuming like with humans, you're kind of watching over time. Is that true?
Oh, exactly. Yeah, so I often talk to owners about, are there more bad days than good days? One thing that some people can do is they have a jar saying good days and a jar saying bad days. And then you put a penny in the jar when it's a good day, penny in the jar when it's a bad day. That will kind of give you a basis over time of, are they having more bad days than good? Because you're with them all the time. So everything can kind of blend into one. So yeah, it's over time, but also sometimes, with certain disease processes, our pets decline very quickly, as well. So then the other things like change in behavior, interacting with the owner, those are important things to follow at that point. Even appetite, change in breathing pattern, things like that.
Great. Okay, that's super helpful. But it's, yeah, you're looking, so it looks like for pattern changes, right? It sounds just changes from their norm that persist, it sounds like, huh? Is that a fair statement?
Yeah.
Okay,
Definitely.
cool. Great. All right, let's So yeah, treatments. What treatments are available for folks? And I suppose this is a different question in our context of advancing illness, end of life, et cetera. I'm assuming here we're thinking really more about incurable illness, cancers, organ failure versus a pneumonia or something more acute. But for chronically ill dogs or just older dogs, are there many treatments to be tried, or how do we even conceive of treatment?
Yeah, so that's a really good point, because a lot of people aren't aware of all that we can do in veterinary medicine these days. So you have your kind of conventional Western medicine approach. So you get your diagnosis, say you have, a terminal cancer like oral melanoma in a dog. That's a very aggressive cancer. Then you want to kind of figure out, okay, well, what can I do to make, we can't cure this. What can we do to make them more comfortable? So our focus kind of changes from cure to comfort. But even with like the Labrador that has really bad arthritis, it gets to a point where that arthritis it's not going to get better. It's going to progress. We need to really make sure that he stays comfortable, So with veterinary palliative medicine, we change that focus from, the cure to the comfort. And we want to really, there are a lot of things that we can do. One trip to the vet is not going to get us exactly what we need to do long term for this pet. So we need to keep this open dialogue with the owners, like, how is your pet doing? These diseases change over time, how they progress, how they're responding to treatment. So, you don't want to throw everything at them all at once. What I tend to do is start them on pain relief, start them on an anti-inflammatory or a steroid if it's appropriate, and then kind of assess their response. And they might do really well up until a point. I won't know as a veterinarian if they're no longer responding to that unless you as the owner have that open dialogue with me or the vet team. So the vet technicians, CSRs or the receptionists, they're huge contributing assets to kind of keeping our pets comfortable and informing the doctors or the vets about what's going on. So we really, we can do many things within Western medicine, but we can also kind of establish an integrative approach with alternative medicine. So acupuncture is becoming a lot more widespread in the veterinary community, particularly in California. And some people don't know about it. Other people know a lot about it. A lot of people have experienced acupuncture themselves for, various, pain, or a lot of people do it for anxiety as well, various things. And the exact same thing applies for pets. So acupuncture can be a fantastic approach to your pain management for arthritis. For example, I had a dog named Connor. He came to me a year ago in August. I diagnosed him with an oral melanoma, which is the most aggressive oral tumor that you can have in a dog, and it spreads very quickly. He was referred to an oncologist. The oncologist said, "Oh, it's really, we would have to remove most of the mandible, and the chances of that being curative is very low." So Connor's owner came to me and said, "Is there anything more that we can do?" Well, Connor at the time was a 14-year-old lab. He had been very active in his day. He loved eating, and he was extremely arthritic. Not only that, but he had a big mass on the lower jaw, which sometimes interfered with his eating, but sometimes didn't. So we started acupuncture. We started it with an intensive 4-week course, so one treatment a week for 4 weeks. And then we implemented herbal treatments, so Chinese medicine herbs, which he tolerated and did fantastic on. Now, the oncologist told Connor's mom that he maybe had 3 to 6 months, 6 months max, and that was with chemo treatment and removing the tumor. Now, I actually just put Connor down about a month ago. So he lived almost a year and a half with treating his arthritis. I focused my treatment with acupuncture on his arthritis to make his mobility better, which really helped. We used help him up harness to help with his, weaker back legs. And we put it, integrated an anti-inflammatory, gabapentin for pain. I kept this open dialogue with his owner. Every couple of weeks we would check in, and if she was worried, she'd check in with me sooner. And we would kind of tailor his treatment according to how well he was doing. So really, long story short, there's a lot of things that we can do in addition to just traditional Western medicine, which can really help with pain management, increasing, quality of life, and really extending a good quality of life and how long that we have with them. I do think Connor is an anomaly. I don't think that's going to happen with every pet, but it's just a really satisfying case that I always take with me, because it shows me that my Western medicine plus my Eastern medicine really did well for him. And he, we managed to keep him around almost a year and a half with good quality.
Beautiful. And I should mention too, we'll send out a recording to folks and with any resources. So Emilie, we can think about if there are websites or places to go for information. We'll put that in an email at the end. Because one thing that comes up with humans is there's all the things to try, but where is there good data? Where's there good anecdotal experience? It's sort of kind of a wild west out there once you get out of the bounds of kind of conventional Western medicine. So if you have any resources, well, think about it, any resources to help people educate themselves on what seems to work, what's more towards sham. But on that note too, do you get one way and another, how stoic, I suppose there's a range, but is it possible, if you're really in tune with your dog or cat or any animal, is it possible that you'd miss when they're in agony just because they can't tell us? Or are animals pretty revelatory that way, one way or another, if we're paying attention?
I was reading an article the other day about pain in animals, and one of the things that, we know certain pets, prey species like rabbits, for example, guinea pigs, they do mask pain, they hide pain, because if they're in the wild and they're limping or something, someone's going to come get them, right? So, but carnivorous species like cats and dogs, they don't actually mask their pain. There are certain breeds, so for example, staffies or pit bulls, they're typically very stoic animals, and so I feel like if you have had this pet for a long time and you're really attuned to them, you're going to know something's off, whether it be with the appetite or not eating, the pattern of eating changes, or the pattern of sleeping changes, the pattern of, wanting to go for walks, how quickly they're going for walks, are they sniffing more, or being really slow. I feel like I always tell owners, you need to trust your instincts, because you are the person that knows this animal the best, and you should trust yourself when you think something's off, because likely there is something's off.
That's super helpful. I always worry. It's super helpful to know that distinction between the predators and the prey kind of wiring. So in other words, if I'm hearing you right, so for my dog Maisie, who's half pit bull, if she's not showing me so these behavioral changes, even subtle ones, it sounds like I can more or less relax into thinking, knowing, feeling some confidence that she's comfortable.
Absolutely.
Yeah, great. Well, that's super helpful. Thank you. Okay. I will sometimes worry that I'll overtreat. So anyway, that's great to know. Thank you.
Yeah, trust yourself.
All right. Well, we've already touched on some of these things, but quality of life for pets and owners. I suppose it's really an interplay too. It's just a team effort. So depending how the owner's doing, depending how the pet's doing, it's sort of a family unit, and everybody's experience is relevant. It sounds like, much like in the human palliative care sort of sphere.
Yeah.
But what more is there to say about quality of life? And it sounds like we've heard a little bit how to read the signs to judge quality in our animals. How often, if there's more to say, please do, but also I guess how did this, maybe we can talk a little bit too about the interplay between the owner's quality of life and the pets. And I know in my own experience, sometimes if I'm being pulled away, et cetera, there's a lot of guilt there can be a lot of guilt. I think about my last dog, Vermont. When I look back on it, honestly, I think I waited too long. I think I tried too many things and did not want to let him go. And I think I may have been causing him some amount of suffering. And I didn't let my own experience color it because I thought, no, it's not about me, it's about the dog. So I was going crazy trying to do all these things. He was not doing well. All that is to say, how do you coach or encourage folks to think along this sort of family unit that everybody's experience is relevant, and how do you sort of navigate the trade-offs?
Yeah, so, like I said before, there's a lot that we can do in veterinary medicine these days with the advances of technology and techniques and extrapolating from human medicine. All that to say, not everybody has the same goals for their pets' end of life care. Some people simply don't believe in, humane euthanasia or taking a life, and that's fair. But me as a veterinarian, then it's my job to make you aware of what the end might look like. For example, a chronic kidney disease cat, a lot of times they can live for a long time without eating, and they become really weak and dehydrated, and they feel really crappy. But it can be a very long, long time to the end. So it's important to kind of find out and figure out within yourself, and perhaps an open dialogue with your vet or friends or family about what you want for the end of life care to be for your pet. So, if you want to wait as long as possible and spend as much time as possible with the pet, you have to kind of come to grips with the end might be a bit traumatic, both for you and also for the pet. So it might mean, rushing off to the ER to put this pet down, right? So we kind of, and a lot of times owners that do that, they do have a little bit of regret, right? So they say, I should have done it sooner. And you don't know until it happens, and every situation's different. So what I would just say is, you've learned from that. You've kind of, with your own experience, you've understood what you don't want, and you for for future, what to look out for, and to say, I don't want to do that again, so this is what what I'll do in the future. So it's also, with all the advances within veterinary care, there are so many specialties and things, but not everybody has the means to provide that type of care. And it's not, because that care exists doesn't mean it's absolutely necessary or right for the patient. So I think a lot of people have that guilt, like, I can't do that $10,000 surgery, which might buy 3 months, and you have to also kind of, we have to be realistic, and those type of extreme measures. Personally, I have to say, if my dog was diagnosed with some sort of cancer, I would not go down the route of chemotherapy. I would go down the route of palliative care. I would want to make her as comfortable as possible, to be honest. I'm gonna get a little bit upset right now because I have a 16-year-old dog sitting right next to me, and she's doing very well right now. But anyway, so it's, every person is different with what they want the end of life care to be for their pet. So it's really kind of understanding and discussing that with people and with your vet to determine what that is, because you can do a lot for your pets. A pet who is going through dementia, who's confused, who's anxious, who's soiling themselves, that, we have to also talk about, is that a good quality of life for the pet? But also, the owner is doing so much, and it's reflected on their life. They're not able to leave the house, or they're worrying constantly about the pet. So, there are a lot of tools that we can use that are available online, and I can give you those websites to kind of assess a family's quality of life along with the pets. And you have to really take both in combination, because it really matters, because your mental health matters just as much. And your pet, when you're anxious or when you're stressed, your pet feeds off of that. They know that, so that might increase their anxiety. So it's it's kind of this vicious circle. So it's just really important to kind of figure out what you want, and having that open dialogue with the vet, I can't express that more, is so important.
Beautiful. Yeah, thank you for that. It is really, I think a lot of us can't hear that enough, but it really is, all the emotions of the family they're all part of it. It's not like the patient is the focus and everyone else is meant to be sort of to subordinate to that. All of these experiences affect each other, and they're
Mhm.
all relevant. And I really love your point here. This comes up for me in the adult and the human thing, of course, is I think it needs to be said, like you did explicitly, like just because we can do something, just because there's someone offering surgery or chemo or whatever it may be, doesn't mean that we have to, and it doesn't even mean it's a good idea
Mhm.
at all. So that's, I think, a really important point. I think a lot of us show our love by, if there's something to do, I'll try it. If it bankrupts me, so be it. I've met a lot
Yeah.
of folks almost wear that bankruptcy as a badge of, that's how much I love so and so, is I'm willing to go bankrupt. And
Mhm.
okay, I hear you, but when we throw in that spending money on that surgery might not actually even help anything, then it becomes a different kind of conversation. And so just because it's being offered doesn't mean it's going to help, doesn't mean you have to do it, etc.
Mhm.
Yeah, boy, the guilt thing is, well, there's a lot to navigate there. So, right, all the roads are pointing back to dialogue and talking these things out over time with your vet, with your family,
Mhm.
checking in on your own gut as well as what you think is going on in the animal. Oh, super helpful, Emily. Okay, thank you. All right, we'll move on to the next slide here. I guess this is just a little bit, maybe I let the cat out of the bag earlier.
Uh,
Uh, but yeah, these are just to say what we probably all feel, but sometimes can be a little sheepish because the signals we get from folks who don't know what it's like to live with an animal. But any thoughts here about the in your practice in your own life of the importance of these relationships?
I mean, yeah. So a lot. So I'm a house call vet now. I do work in some hospitals, but as a result of starting a house call practice, I um, interact differently with my clients. It's a lot more personal, and I see how much their pets are an integrated part of their lives. So it's not it's not only, I do have a number of elderly clients that aren't able to take their pets to the hospital, hence why they have a house call vet. Um, and those pets, usually it's a cat or a dog, usually those are a constant companion for them. They're bringing them, love constantly. They're a reason to get up in the morning and to take care of themselves and take care of the pets. And, so um, it's also, I feel pets are a way to tie the family together. For example, when I was 15, we moved to Norway, and it was a very hard, my mother's Norwegian. It was a very hard move for us, as you can imagine, as a 15-year-old. I was like always the tallest, and I never wanted to be in the spotlight, and I was American and moving to Norway. So that was a very hard thing. And when we moved, we weren't able to take our two family dogs with us. It was me, my brother, my two brothers, and my mom. And about 6 months after we moved there, we made an agreement. We need a dog. And that
Mm.
dog, we got a dog named Leia. And she had a lot of medical issues throughout the years. And I remember thinking about her a lot during vet school, thinking that's what Leia had. Oh, that's the disease process that Leia had. But anyways, long story short, she was the glue that tied us together, and she got us through that difficult time. So, they're I don't know, they're not just animals, they're literally part of your family. I mean, if you've had a cat for 15, 16 years, they're like having a 16-year-old kid. I know it's not a human, but I mean, you've had them for that length of time. So, for me personally, my dog Mia, I got her in college, and she's been with me through the rest of my undergrad. She went to Europe with me. all through vet school. She came back to the United States with me, and she's been through so many phases of my life that it's really hard to imagine a life without her. So, just speaking from my own experiences, she's she's my child, she's my my companion, and definitely more than just a pet, I would say.
Hmm. Amen. And I suppose also for me too, one of the things living with animals do is reminds me that I too am an animal. I think we often seem to like to separate human nature from the rest of nature, and seem to be a particular species. But one thing that's so lovely is to see, on some level, to see myself in these animals, and not just
Yeah.
purely as a projection or anthropomorphizing, but rather maybe in the other direction, seeing the animal in me, as well as the consciousness, perhaps in the animal.
Mm.
Uh, it's been lovely to feel the blurring of the lines between humans and the rest of the animal world. I don't know if that's something that lights up for you or anybody else on the call, but just over the recent years, I think maybe it's coming to terms with this sort of Anthropocene, this idea of humans put themselves in the center of everything, and now we're kind of getting a sense that Mother Nature may have other plans, and maybe we're not the center of the world, and maybe we're not the only ones who have consciousness, et cetera, or feelings. So anyway, there's probably lots to say about that, but I do really love feeling the animal in me as much as seeing the human in them, or something like that. Okay. Well, gosh, I think we could speak on this one forever, and I'm sure there are a lot of examples on the folks listening here. So let me keep moving so we can get to the dialogue. So outside projections. So this could mean many things. Projections from others, like hey, when you get a new dog, like that kind of attitude, or maybe this sort of overly. I know I've seen a lot of. I kind of inherited this idea that we should not give our dogs, human food. The drive-through at McDonald's is not a time to be throwing some meat to your dog. That we're actually, first of all, there's some training issues around that, and boundary issues around that may not be healthy for the dynamic, the herd, of the herd, but also just physically. So I've seen a lot of people treat their dogs as humans, for example, or their cats as humans, and relishing that and feeling proud about that. But sometimes I wonder, gosh, is that really? I mean, there are limits to these projections. They are a different species, and so I may be going down a different track than you might want to take this. But how do we think about the projections, knowing that animals can't speak for themselves? We're always projecting onto them. And is there a way to kind of guide us? And when is that a healthy endeavor? And when maybe we're kind of maybe it reflects a misunderstanding? And how do we counsel people in dealing with the projections from others about this relationship of ours? Anything light up for you in there, Emilie?
Well, one thing did, but especially when you've lost a pet or something, a lot of times owners are faced with the question from people, well, are you going to get a new one, or are you going to get, what's the next step? And so sometimes that can be a difficult answer to hear, or sorry, difficult question to hear, I feel. Yeah, what are your opinions on things like this?
Well, it comes up in the human medical world too, where the projections all over the place, and people saying kind of wayward things or thoughtless things, or just not sure what to say. And I think I extend the same kind of benefit of the doubt whenever I can when it comes to talking about my animals as I do talking about humans. That we do have shared experiences, that's for sure, and we're all variations on themes, but those variations have particulars to them and need to be respected. And so depending on my mood, how I'll hear those projections, sometimes I'll just reject them and kind of maybe smile and try to get out of the conversation or keep moving. Sometimes I'll hear it, just the struggle in person to understand this dynamic, and maybe I'll open up a conversation and say, well, no, it's not really like that. For me, it's this, and you open up a deepening conversation sometimes. And oftentimes too, I'm left just feeling I remind myself, just for my own sake, to not internalize some of their comments, to say, well, that's their that's their stuff. They don't understand. They haven't had these kinds of experiences. Deflect, not internalize some of the stuff I hear from folks. So that's sort of on the emotional front. And on the sort of more nutritional, natural front, is it am I kind of is it accurate that we should be very leery of giving our animals human food and with all the oils and stuff in there? Is there, to take it to the sort of physiology for a second, how should we think about that?
Well, if you go to the pet store these days, you're going to find a lot of human grade food, to be honest. So, I would say like a hamburger patty from McDonald's isn't the healthiest, just like it's not for us. But, human grade foods are something that are here to stay for pets. The important thing to know, just kind of from a nutritional standpoint, is home cooked diets like of human food are not necessarily balanced. So we the reason I normally recommend a commercial diet is because our big companies like Royal Canin and Science Diet, they have a nutritional staff, nutritional specialists on board to make sure that these diets are formulated in a safe manner. For example, formulated for growth for puppies and kittens, or formulated for our aging pets with additional antioxidants and omega fish oils. So all that to say, a Yorkie that's on mainly chicken, that's not enough calcium for them, and they can get real metabolic problems with their calcium balance, and they get something called a rubber jaw. So, it's important to know that they need their, we kind of just eat whatever we eat, and we don't necessarily supplement. Vegetarians or vegans might supplement B12 or whatever, but not always, and we still do pretty well. Dogs and cats are not the same. Cats are obligate carnivores. They need meat. They don't produce taurine themselves like dogs and us do, and if they get a taurine deficient diet, they get a huge problem with their heart. So feeding them a balanced diet is just as important as feeding a dog a balanced diet. So I don't think the human food is going to hurt, but it might contribute to things like obesity, which can be really tough on the joints. And obesity in cats really predisposes them to diabetes. So just kind of things to think about, I guess.
Yeah, I remember with Vermont, my last dog, I just loved, he was a lab golden retriever mix, and he loved to eat, and I loved to feed him. And all of a sudden he was 20 pounds overweight and having all sorts of joint pain. And then when I talked to the vet, we put him on a balanced science diet thing, pulled 20 pounds off, and he was like a new dog. I mean, it was a huge change in his comfort and his mobility, et cetera. So anyhow, okay, well, gosh, let's keep moving, because there's questions coming up, and I think you and I could just talk for hours by ourselves. So let me move on here. We've talked a little bit about this one, so maybe we can just end the slides today real quickly. Grief, it's something that we in this community have talked a fair amount about it, but a lot of people in the call have been part of those conversations. But from where I sit, it's just simply to notice that these can be enormous losses and are due all the ritual and time and space that a human to human loss would deserve, if that's the right word. But anything from your experience too, Emilie, to add to the grieving process around pet loss?
Yeah, well, it's not necessarily just after you lose a pet. It's also that anticipatory grief, right? And it's like, well, how long am I going to have him for? And are they going to suffer? It's all that worry as well. And, I can't stress enough, and I've said this so many times, but making sure that you have a plan with your healthcare provider, with your vet team is really important to make sure that those worries and concerns that you have are addressed. But it also helps with that grief afterwards, that grief with planning beforehand and making sure that we have a good plan and that everything goes well really helps with kind of knowing after you've lost the pet that I did everything I could. I I addressed, the concerns that I had. It kind of gives you more comfort afterwards, I guess, is more
Yeah.
closure after you've lost a pet. And we all know we're not going to have our pets for forever. They age ridiculously quickly compared to we do. So, and we all feel it's quite unfair, but there are things beforehand that you can do to minimize that sorrow, that grief afterwards. You're always going to love them. You're always going to miss them. It's always going to kind of be difficult to think about, but what we can do beforehand really can help how we feel about it afterwards is just how I see it. What about you?
Yeah, very much the same. And that a lot of us are prone to that sort of self-recrimination. Well, what did I do? I should have done this. I could have done that. So to your point, that planning in advance and being true to what's happening in real time and talking about it with family and with the vet, it makes a lot of sense that that will help ease the grief that you're heading for and cut down on the regrets and the recrimination. So yeah, it seems like it's very much akin to how we would grieve anything else, and including the anticipatory grief, as you point out, Emily. So awesome. Okay, well, guys, let's get to questions. Sure, they're out there. Sonia, what do you see?
Yeah, we've got a few questions that have come up. The first one, this person asked, in a multiple pet household, how best do we help our other pets when one pet becomes sick? She said hierarchy issues, their own grief, etc.
Yeah, that's a good question. I think I get that question quite a lot, actually. So just kind of that also goes into the planning beforehand and how much, if the pet is sick, how much care they need, with regards to how long um, that kind of end of life process is going to be. So if for example, if you have a pet that, is no longer ambulatory, not able to walk, um, the other pets in the house know there's something wrong with that pet. I have to say that. So they know that there's something going on. But if you're at a point where you're spending all of your time trying to care for that sick pet and it's to the detriment of the other pets, that also has to go into the quality of life of the owners, and if they're not able to, to care for the other pets. I don't know if that was an element of that question, but just something I thought about. Um, um, with regards to grieving another pet, yes, some pets are very bonded, so like bonded cats or dogs that are bonded. Usually, a dog who loses another dog, it can increase their anxiety, but at the same time, it can actually make them more close with the owner, and be more bonded with the owner. So some people might say more clingy. So yeah, that's definitely possible. The same can go with cats, but I do think that there's this inherent uh, knowledge of if one of their comrades is sick, and if they've passed away. I do, when I do put a pet down in the home, I do say to owners, if you want your other pets to come and sniff the body to understand that, for example, Samson is no longer with us, then I do invite that. Whether that absolutely is going to help them with the grieving process that the other pets in the household, I'm not really sure, but I think it can't help, and it might even help the owner with it, just worrying a little bit less about the other pets. There is a mourning period that we know goes on with some pets, and they might, seclude themselves or be a bit more anxious and stuff like that. So I always do warn the owners of that. And really, it's just kind of supporting them and making sure that, especially with anxiety, you want to stick to a routine so that your day is predictable. So that can really help reduce the anxiety and try to get them through this process, if that makes sense.
Yeah. Yeah, fascinating stuff. Okay, Sonia, what else is out?
We've got a lot of good questions coming in. This person said, can you please talk about the role of children who have an older or dying pet and how much they should be included in the process?
Older children, yeah. So a lot of times, an older pet with a 10-year-old might have been there since the child was born, and so that's very difficult. I think it's very important for the for the parents to have that conversation with the child, to let them know what's going on, to be absolutely honest. Keep that open dialogue that Fluffy is doing, is sick, and it might be a time to to let him go because we don't want him to suffer. So I personally think that's very important, for owners. I always call them owners, for parents to speak to their children about, and I invite them to be present during appointments. I usually explain it in a different way to a child, to get them to understand what's going on, if that's what the parents want me to do. So I think they're quite intelligent, kids are, and so we need to kind of make sure that things make sense for them, so that they understand what's going on. And it's not that we want to get rid of Fluffy, it's that Fluffy is not doing well and might have to we might have to end the suffering.
Hmm. Yeah, as you're talking, Emily, it's I'm thinking it's a question that kind of also gets at childhood development. And so a 6-year-old versus a 12-year-old may be in a very different place to understand mortality in the first place. And in the human world, when we're talking to kids about loss of parents or siblings, we often will say, these days, what data we have around this is we tend to point folks away from using euphemisms. So like Fluffy's going to a better place. Well, for some kids at certain developmental ages, that may sound like, well, why aren't I going with Fluffy? I want to go to a better place, or things like this. So sometimes we think we're sparing kids by speaking indirectly or using euphemisms, when often we just confuse the heck out of the kid. And to your point, Emily, kids are smart. They know what's going on. They know something's happening here. So oftentimes, as a rule of thumb with kids, whether it's human or animal loss or pet loss, is to be direct. Take your cues from them. So if the kid is signaling that he really doesn't want to be in the room, there's no need to force it. But also, I think it can be helpful to welcome a kid into the process so they feel part of it, so they get to experience this sort of big life process happening, so we don't accidentally put death in the closet and then make trouble for that kid later. So honest, loving conversation and taking your cues from the kids generally rules the day. Of course, in your own family vernacular, your own cultural dynamics will color this, and the language you choose to use, etc. And of course, go with that. The idea is to make this experience part of the fabric of normal life. And so using language that suits normal life for them is the way to go as a rule. So these are sort of generalized rules of thumb. But okay, what's next, Sonia?
Yeah, this next person said, when a pet has been with you for almost 2 decades, how can you shake the extreme grief and the deep loss that comes with your pet's sudden absence, even if, you did everything right leading up to that death?
Can you repeat the beginning of the question, Sonia?
Yeah, of course. So this is just when someone has had a pet for almost 2 decades. So the grief of the extreme grief, extreme deep loss that comes with that loss after that period of time.
Yeah. Well, I can jump in here too, Emily. I think we'll both have something to say here. I mean, just speaking from sort of loss, there's something generalizable about loss especially of a family member, human or otherwise. I mean, in 20 years, a long chunk of time. That's a big time to be entwined with an animal in a very intimate way. And so I think one thing to just say out of the chutes would be, we tend to shortchange grief. We tend to think the cues that we send each other these days tend to be like, well, get on back on the horse, get on out there, and this is such as life, move on. Again, the more and more we experience it, you really can't shortcut grief. If you try, it'll come around and bite you somehow. So here, I think that from my point of view, it's just sort of generalizable around loss. Give yourself tons of time and space. This is going to take, it's not something you're going to get over. It's going to take a while to accommodate this loss, even to believe this loss in the first place, and all the magical thinking that can come into play. I mean, when I lost Vermont, my last dog, he was a service dog with me 24 hours a day. I was constantly looking for him. It just felt, I was 11 years together, 24 hours a day. He was a part of my body in a way. And I was looking for him for months and years after he was gone. So giving yourself, that's normal, that's real. That's not you being crazy. That's you in grief. So that's, I can just sort of start off the comments that way. But Emilie, in your experience, anything else to add to that mix?
I think you hit the nail on the head, to be honest. 20 years is fantastic. I have to say it's a real testament to how well that pet was taken care of too. So I think you can take confidence in that. And even though we do everything right, it doesn't mean that they're going to live forever, unfortunately. So we have to also accept that and know that, you know, you were very fortunate to have the 20 years. I feel that way about my own pet. And I think it's part of the normal process, as you say. I think you're always going to be grieving. You're always going to miss them. They'll always be in your heart. You're always going to remember them, but yeah, giving it enough time to process that. And I don't think getting over it is the right term, because I don't think you ever get over it, but just kind of accepting it perhaps, and knowing that, I'd have confidence if a pet lived for 20 years, that's pretty phenomenal, to be honest. So yeah.
Right. And beautiful. I guess one that's just a reminder too. Again, maybe we've said it or implied it. Like, I think if we're talking about pet loss, you may need to, in a way, take extra steps to kind of communicate that you're going to need help, because the world will send you cues. Like, it's hard enough if you lose your parent these days to get people to understand and give you enough time and space, because we just haven't had a big social understanding around grief. And I'd imagine the cues you'll get around pet loss will be even more wooden and thoughtless, and an implication be that you should be over this. So resist that. You should be your own judge and jury here, and bring your inner circle and let them know what you're going through, so that they can be supportive. Okay, Sonia, we got a couple more minutes. Any other questions or comments, guys?
Yeah, we've got two more. Let's see if we can try to get through these now, and maybe we'll just go a little bit over. First of the two is, what are your thoughts on bringing a dog into the house when you already have a senior dog? Will the senior dog be upset or hurt? Is that best to not do that?
That's a good question. I think it really depends on the dog, the senior dog, but it also depends on the situation, and it also depends on the dog that's brought into the home. So, for example, some people get a puppy when they have a senior dog, or when the dog is starting to get older. It's important that the puppies can be very rambunctious and want to play like crazy, and the elderly pet or elderly dog might be a bit grumpy or like just relaxed kid, and it's important to make sure that elderly pet is not bothered, I would say, and is accepting. There's a lot of things that you can do as well, as really good training with the puppy, making sure that they're, not or new dog into the home, making sure that they're not causing any distress or anxiety to the older pet. I don't think bringing another pet into the house when you have a senior pet is a bad idea. I think it definitely depends on your pet, if they're okay with other dogs or cats, and kind of the making sure that they are taken care of and not, I want to say bullied, but it's not really bullied. Just like puppies can be a bit much for older pets. So making sure that they have their quiet space, that they can be left alone when they want to be left alone, and making sure that dog or cat or that dog is well trained is the most important. And the same goes with cats. Like older cats, they need to keep they're very territorial, so like very gradual introduction of a kitten. If you say bring a kitten into the home, making sure there are resources throughout the house. So multiple litter boxes, so the elderly cat isn't having to kind of fight for the resources, making sure there's food and water bowls around. So there's no conflict around those resources is very important. I personally have my cat because a client of mine had rescued a kitten, and my cat kept beating up on the kitten, and it had to do a lot with the situation, that the living situation, and it was a very small quarters, and they weren't able to be introduced gradually. So, it's really important to kind of make sure, if you're going to bring say a kitten in, that your elderly cat is has their safe space where they can go and be left alone, has their resources and things to make sure that that isn't affected, and has equal access to you, because that's a big thing with their quality is interacting with the owners. Do you have anything to add, BJ?
No, that's beautiful. That's right on. Thank you. Sonia, do you say we have one more? Do we have?
Yeah, we have one more. Let's go over a little bit and see if we can address this one while we have Emily. So this person said, I've never had to put a pet down. Can you describe what this process is like and how it happens? I'm assuming there is no pain. Are there things that can be done to make this event less clinical and more spiritual?
Yeah, absolutely. That's a very good question. And a lot of people who haven't experienced putting a pet down, have a lot of questions around this. So I'll just explain to you what I tend to do. So first of all, in-home setting can be probably more comfortable both for the owner and for the pet. If that's not possible, if your pet is anxious about going to the vet or about going into car rides, if it is time to put them down, giving a sedative before the trip to help calm the anxiety at home is a really good way to start off the whole process. Once, say, I'll just give you an example of when I'm in the home setting. Once I get there, I introduce myself to the family and talk to them about, what's been going on. If I'm not familiar with the case and I'm not familiar with the pet, I'll make friends with the pet. I usually bring some treats just to kind of get them used to me, they love to sniff my bag. It smells like all of the other animals and get inside my bag maybe. But I'll also have a conversation with the owners about what the process will be. The first thing that most vets do is give, after everything's said and done and the process starts, is we normally give the dog or cat an injection of a sedative. So this is a really heavy sedative. It's to take away any pain, any anxiety, and make the whole process smoother. I normally give an injection underneath the skin, but it can be given in the muscle as well. And then I just ask owners to sit around the pet while they get sleepy. Usually it takes about 10 or 15 minutes. It depends on the route and it depends on the pet. To get sleepy, and they usually get really sleepy, so they put their head down and are nice and calm. That's exactly what you want, is them to be nice and calm, pain-free, no anxiety. And so after that injection and the pet is nice and relaxed, then the final injection is given, and that's normally of a medication called pentobarbital, which is a sedative. They use in human medicine. We use it in a very high dose, which will ultimately end in heart stopping. There are the route of administration is different for different pets in different situations, okay? So we are going a lot more towards intra-organ routes, so going into an organ in the abdomen, the kidneys in a cat or the liver. If external vein, if a vein is not accessible, if it's difficult to get a vein, and that can happen in really frail pets or very dehydrated pets. Avoiding having to go into the vein in those situations by going into an organ can really relieve a lot of anxiety for both the owners, but also make the whole process smoother. Intra-organ can be very, very quick. They're not going to feel it at all. Some other times it takes about 10 or 15 minutes. And the whole time, the vet should be talking to you about what's going on, the breathing pattern changing, what's possible. Sometimes there's a little bit of muscle twitching. Very rare when you give a pre-medicated sedation do you see vocalization, but sometimes we do. And then ultimately, once we give the injection, and the breathing is going to stop, and then ultimately the heart will stop, and that'll be confirmed when we listen to it with our stethoscope. So that's essentially the process. Occasionally there's, some urination or defecation afterwards, but I usually mention that to owners, and that's just because everything's kind of relaxing, so it's just the whole process is supposed to be as smooth and pain-free and anxiety-free as possible for both the owners and the pet. And that pre-medication with a sedation injection first is the thing that allows us to achieve that. So I hope that answered the question.
Can I ask real quick, Emma? I know we should get going here on time, but do you ever sense when I put my last dog, Vermont, down, I almost had the feeling that he knew this was coming. Is that pure? Do you sense that's just me projecting, or do you ever get that feeling that the animal knows this is what's happening?
That's a good question. I don't think about that often. I think often the pets are very attuned to you, and perhaps they're so trusting or so willing because you are as well, and you've come to the decision. I don't really think that they contemplate their death like humans do, so I do think it has to do with how we feel about it is how our pets feel about it. Does that make sense?
Totally, makes great sense. Yeah. And I'll just say to the callers, person who asked this question is, and I think this is where your relationship with your vet, in terms of taking out of this sort of medicalized realm and into a more human or spiritual realm, that comes through the relationship with, like, Dr. Emilie, with your vet. And that's another reason to be in close contact and keep the communication going. It also comes from having family around. The idea of being at home versus in a clinical setting might be really, really powerful. And I think more and more, is it true, Emilie, that there are more and more hospice vets who will come to the home? Is that a true statement?
Yeah, it's becoming more popular and more available.
Yeah. And then taking time to ritualize around it, to mark this moment, the keepsake or whatever it may be, but to mark this moment is very big. I remember after I put Vermont down, it was at a place where he had gotten a lot of chemo and other things I had pushed. And I remember I had to go, I left, I went home, and it just didn't feel real what happened seemed to go so quickly, it didn't feel real. And I remember I went back to the clinic and asked if I could just be with Vermont's body for a while. I just sat with his now deceased body, and it took me a minute to really let it sink in. And there was something very powerful for me sitting with his now lifeless body that really helped me believe this had happened, and it helped me feel like it did something good for me, is all I can say. So find your way and don't let anyone sort of take any of the power out of the moment. Protect the time and space around it for yourself to mark it. This is a huge moment. So, okay, guys, thank you for staying late, Emilie. I've loved this. I really, really appreciate you coming here and being with us.
Thanks for having me.
And we'll put the recording out in the world and any other resources we can think of as usual. But thank you, everybody, for joining us. Thank you, Dr. Ravn, for joining us. Thank you, Sonia, and happy holidays-ish out there.
Thanks for being here, everyone. Have a good weekend.
Bye, guys.
Bye.